The fluorescent lights hummed overhead as Sarah, a dedicated CNA working her way through college, arrived at the nursing home that Monday morning. She had no idea she was about to face an impossible choice that would haunt the healthcare industry's conscience. At 65 beds, the facility was already understaffed on good days. But this wasn't a good day. This was the day her colleagues had chosen to make their stand against a management system that had pushed them past their breaking point. For months, Sarah had watched her fellow CNAs struggle under impossible conditions. While management sat comfortably in their offices, earning substantial salaries and sharing laughs throughout their leisurely days, the CNAs worked themselves to exhaustion for a fraction of that pay. The contrast was stark and painful. Executives in pressed suits discussing profit margins while floor staff rushed between rooms, their scrubs stained with the reality of understaffed care. The breaking point came when management refused yet another request for raises, despite the facility's growing reputation crisis. No new employees would accept positions there. Word had spread throughout the healthcare community about the toxic environment, the impossible workloads, and the callous indifference of leadership. Sarah's colleagues had devised a desperate plan, a coordinated strike that would force management's hand. By calling out simultaneously, they would create a crisis so severe that expensive agency nurses would drain the facility's budget, drawing the owner's attention and potentially triggering a state investigation. It was their last hope for change. Sarah hadn't participated in planning the strike. As a college student just months from graduation with her social work degree, she couldn't risk losing her income. She needed this job to survive her final semester, so she kept her head down and tried to weather the storm. But when she arrived that Monday morning, the full weight of her colleagues' desperation became clear. Every single CNA except Sarah had called out sick. 65 elderly residents, many with dementia, mobility issues, and complex medical needs, had only one CNA available to care for them. One nurse and 2 medication technicians completed the skeleton crew attempting to manage what should have required at least 8 CNAs. The hallways felt eerily quiet as Sarah stood at the time clock, her hand hovering over her badge. Management had already erupted into panic, frantically calling agency services only to find no last-minute replacements available. The reality of their staffing crisis had finally caught up with them. Sarah made a decision that would define her integrity. She refused to clock in. Legally, she couldn't be charged with patient abandonment since she never officially started her shift, and a registered nurse remained on duty. But the pressure began immediately. The manager's face flushed red as she cornered Sarah near the entrance. "You have to stay," she pleaded, desperation creeping into her voice. "These residents will sit in soiled diapers all day. We can't possibly change everyone with this few people." The nurse joined in, painting horrific scenarios. Someone could fall trying to reach the bathroom alone. Without anyone making regular rounds, we might not find them for hours. Someone could die, Sarah. Their blood would be on your hands. The emotional manipulation was suffocating. Sarah could picture Mrs. Henderson in room 12, who called for help every few minutes due to her anxiety. She thought of Mr. Rodriguez, whose diabetes required careful monitoring. The faces of residents she'd grown to care about flashed through her mind, but Sarah held firm, her voice steady despite the turmoil in her chest. "It's not fair to expect me to be the only CNA for 65 residents. This crisis isn't my fault, it's the result of management's failures." Her words cut through the guilt-tripping like a knife. "Call the owners," she told the director of nursing directly. "Tell them you've chased away every employee and ask for their advice." Both women knew what that conversation would mean for the manager's career. Sarah walked away, leaving behind a facility in crisis and management finally facing the consequences of their negligence. The residents deserved better. The staff deserved better. And sometimes, refusing to enable a broken system is the only way to force real change. What would you have done in Sarah's position? Should healthcare workers sacrifice themselves to cover for management failures, or was she right to walk away? Share your thoughts. This situation is happening in facilities across the country right now.